Hello, Assalamu alaikum wa rahmatullahi wa barakatuh. Welcome back to my channel. This is Dr. Sana. Today we are going to talk about the topic sexual frustrations. Sexual frustrations are seen in both men and women. The way it is presented as differs from both genders. Like for men, it is more like mental health issues, but for the females, it is usually presented as physical health issues. Why this frustration differs in both gender? It is because mental health and physical health are um, like two sides of a coin. Today we are going to discuss about the sexual frustrations in men. Other than women, it is more easily or more identifiable or more it is more exposed in men than in female. So let's start. Sexual frustrations in men is the feeling of unmet sexual desires or dissatisfaction, often when sexual needs, expectations, or opportunities aren't being fulfilled. It's very common, can be temporary or ongoing depending upon the situations. Let's look into what it feels like. Persistent sexual desire without release or satisfaction, irritability or restlessness, difficulty in concentrating, feeling tense or on edge, always on edge, sometimes mood swings or low motivation. So now let's look into what are the common causes for this problem. One is lack of sexual activity, mainly no partner or long gaps without intimacy, or maybe the partner loss of his partner, or loss of his better half for a long time, etc. Second cause is a mismatch in relationship. Different libido levels between the partners, or lack of communication about the needs. Number three is sexual dysfunction. Issues like erectile dysfunction or premature ejaculation, etc. Number four is psychological factors, stress, anxiety, depression, or performance pressure, etc. Number five is overstimulation from media, like frequent porn use, which can raise the expectations and reduce satisfaction with the real life partners or real life intimacy. Number six is hormonal factors. Low testosterone levels can affect the desire and satisfaction. Now let's look into how it can show up behaviorally. Increased irritability or anger, obsessive sexual thoughts, withdrawal from partner, risky or impulsive decisions, overuse of pornography or masturbation. Now let's look into a common question. Is it normal? Um, yes, to a degree it is normal. Sexual desire is a natural biological drive. It becomes over concerned when it causes distress or affects the daily life. It leads to unhealthy coping behaviors and when it harms the relationship. Now let's look into healthy ways to manage the sexual frustration. Number one is physical release. Masturbation is the normal and safe outlet, but it should be balanced, not compulsive. Number two is improve communications. Talk openly with your partner about your needs and expectations. Number three is manage mental stress. Exercise, meditation, hobbies, reduce your anxiety and overthinking, etc. Number four is limit unrealistic stimulation, like reduce the use of excessive pornography if it's affecting the real life satisfaction. Okay. Number 5 is focus on overall intimacy. Build healthy emotional connection, not just physical, which builds deeper satisfaction. Number 6 is lifestyle habits. Sleep well, exercise regularly, eat healthy foods which support hormones. Now let's look into next question, when to seek help. If constant frustrations leading to anger or depression, or you have sexual problems like erectile dysfunction, low libido, persist, or compulsive sexual behavior develops. I talked about this in one of my previous videos like behavioral sexual abnormalities. If you develop any of the compulsive sexual behavior, then you should consult a doctor or therapist whom can help you with identifying whether it's physical, psychological, or both. Now, let's look into some key points. Sexual frustration is not just about the lack of sex, it is often about the expectations, connections, and mental state. So, that's today's point. Let's stop over here today. We'll come back with another topic in the next video. Thanks for watching. Assalamu alaikum wa rahmatullahi wa barakatuh.